Okay, and we're here today with Brandon Hayes-Latin and Adam Clark, Dr. Adam Clark, and we're talking about e-records. And so, Brandon, can you explain to us real quick about what e-records are and who they would benefit?
Sure. So, e-records are electronic medical records, and it's basically a digital representation of all of the parts of your cancer story. Your diagnosis, your lab tests, your images from x-rays and CAT scans, and even the tissues and biological samples can all be tracked digitally. And that's really important for really everybody involved in cancer care. It's critically important for patients because it gives you the chance to store and retrieve these records quickly and easily, so that if you have lots of doctors and other providers across lots of different, different hospitals or states even, that you have a way to rapidly access that data. It's important for the doctors because they can take best care of you if they know all the information, don't have to repeat tests. If they know that you've had a scan somewhere else, that they can rapidly take a look at that and factor that into their assessments and plans. And it's also really important for research because just like telling your story is important for other patients like you to understand what you've gone through, sharing that data is really what research is all about. So if you're a researcher and you're looking at a particular gene, you need to find patients who have a mutation in that gene. You could search electronically to find just the patients who they might have the target you're researching. So really important for all aspects of cancer care.
Okay, great. And Dr. Clark, so some people might be concerned about having medical records be available to other individuals. Can you explain what the principles are to ensure the protection of the patient?
Certainly. So some of the things we're looking at, we recognize e-health is on its way, and that it really can make care more patient-centric and can improve the relationship between patient and his or her physician, as well as allow the team of physicians and healthcare providers to better coordinate care focused on the patient. But we also recognize the sensitivity of a lot of this information. So as we look at this growing landscape of e-health exchange, we want to make sure that the patient is going to be in control of the exchange of his or her health information, that they'll be able to opt in and opt out of different types of exchange, whether that's the patient to doctor, the doctor to another doctor, and that the patient is going to be allowed to provide the utmost privacy and anonymity if the patient wants to allow this information to go out to researchers. We do want patients to be able to control the flow of the information. We also want the patient to know anytime anyone who might access their personal medical information. So those are the things that we're looking at. We do recognize that the patient, the researcher, and the clinician are all partners in this, but that ultimately if we work together, we're going to be able to transform the landscape of care.
That's great. And with the recent GE commercial that talks about the importance of e-records, can one of you just discuss really quickly what our feelings are towards that?
Well, I mean, I think what you see there is, on the one hand, an example of a provider with a patient who's thinking about a clinical problem and wondering what other tests have been done in the past that might help me answer this question. That's extremely exciting. If you had the ability to look up all of the scans and records that have happened before and not have to repeat tests and things like that. But one of the other aspects of that commercial is it's very doctor-centric. It's taking a look at how the doctor would access other doctors' records as opposed to really putting the patient in control. Unfortunately, the patient's the one sitting there with no pants on, where the doctor is out searching the record, instead of the patient saying, well, doctor, I actually have control of my medical record. What aspects of my past history are you interested in, which would be helpful for you, and I'll deliver them.
Okay, great. Well, thanks a lot, and more to come on electronic medical records.